At this time, I'm going to be reviewing the patient's orders. I'm going to walk into the patient's room. My name is Krystal Garcia. I'll be the RN assisting you today. I'm going to be providing you with some privacy, and I'm going to be washing my hands and donning gloves. Could you please verify your name and date of birth for me?
John Doe, August 22nd, 1988.
Okay, the records match. Do you have any allergies?
No.
You have no allergies to iodine, latex, or shellfish?
No.
Okay, I'm going to ask you a few questions today. Do you know where you are right now?
West Coast Hospital.
Do you know what year it is?
2020.
Do you know who the President of the United States is?
Donald Trump.
Do you know why you're here today?
To get a physical assessment.
Okay, the patient is oriented in alert times 4. I'm going to ask you a few more questions. Do you smoke tobacco?
No.
Do you use any recreational drugs?
No.
Do you drink alcohol?
I do not.
Do you have any suicidal tendencies or idolizations?
No.
Do you feel uncomfortable in your home, or is there any
Yes.
You feel uncomfortable in your home?
I feel comfortable at home.
Oh, okay. I'm going to also ask you, do you have any hearing aids?
No.
Do you have any assisted devices for ambulation?
I do not.
Do you have any dentures?
No.
Do you wear contacts or glasses?
No.
Okay. So at this time, I'm going to be doing a physical assessment. I'm going to start off. Oh, one more question. Do you have any nausea or vomiting?
No.
Okay. When was your last bowel movement?
This morning.
And was it how was the color of the stool?
It was brown.
Okay. Was it watery? Was it like a diarrhea, or was it a regular type of consistency?
It was regular type. It was normal.
Okay. And when was the last time you urinated?
30 minutes ago.
And is there any pain, bleeding, or hesitation within your urination?
None.
None. There's no discoloration or odor in your. Okay. So at this time, I'm going to start the physical assessment. Okay. I'm going to begin by inspecting your scalp, making sure that there's no dryness, irritations, lacerations, mass, or infestations. I'm going to be inspecting your face. I see that it's symmetrical on both sides. I'm going to be using my pen light to be checking your ears. Make sure that there's no occlusions, that there's no drainage on both sides. I'm also going to be asking you to raise your hand on which ear you hear the sound. Okay, perfect. You said you have no contacts or no glasses.
No. So
we did the Selin chart, and his visual acuity is 20/20. At this time, I'm going to ask you to follow my pen. Okay, perfect. I'm going to ask you to look at my finger, and I'm going to shine a light and look at your pupils. Okay, the patient's pupils are equal, round, and reactive to light and accommodations. I'm going to be checking your nose. Could you lift your head back? Make sure that there's no occlusion. Could you smell in one nostril? Smell in the other? Okay, the patient has patency on both sides. I'm also inspecting the patient's lips. There's no cracking, dryness, or bleeding. Could you open your mouth for me? All right, I'm assessing the patient's gum. There's no dryness. There's no cracking. There's no bleeding. The patient can stick out their tongue and move it up, down, and side to side. Could you swallow for me? Do you have any difficulty swallowing? Is there any pain involved?
No.
Okay, perfect. The patient also does not have any bad breath. He seems of good hygiene and an overall good mood. At this time, I'm going to ask you to close your eyes and tell me what you smell.
Alcohol.
Okay, perfect. Could you tell me on what part of your head I'm touching?
The forehead. The left cheek.
Okay, perfect. At this time, I'm going to be assessing your lymph nodes. I'm going to start with the submental in the front. I'm checking for any tenderness or swelling. I'm going to go back to the supraclavicular, and then I'm also going to ask you to please lift up your armpits, and I'm going to check the axillary. Is there any tenderness? Did you feel any pain?
No.
So in the patient's lymph nodes, there was no tenderness, there was no pain, and there was no inflammation. At this time, I'm also going to be checking your pulses. I'm going to start by doing the radial pulse, the ulnar pulse, and the brachial pulse. And then I'm going to move into it in the other arm, the radial, the ulnar, and the brachial. I will also ask the patient to lift your arms to your side and move them around. Put your hands above your head. Okay, perfect. Do you have any difficulties doing your day-to-day activities with any of your extremities?
No.
Or any pain or discomfort?
None.
Okay, I'm going to ask you to put out your arms like this. And I'm going to push it on my hands as much as you can. Perfect. And I'm going to do the same. Perfect. Now, could you do this on your knees for me? Okay, perfect. I'm also going to be checking your pulses. So I'm going to be at this time assessing the patient's lower extremities, making sure that there is no redness, there's no edema, that the hair distribution is fine, and that the skin isn't cold and clammy. The patient, I'm going to be checking the post-tibial pulse and the pedis duralis on both sides, post-tibial, pedis duralis, pedis. At this time, there's no edema signs, there's no signs of redness or uneven distribution of hair or inflammation noted. I'm going to ask you to lift your left leg up and bend it, and I'm going to ask you to push as hard as you can. Perfect. And do the same thing on the other one. Push as hard as you can. Perfect. Could you lift your ankles and twist them for me? Perfect. So the patient is experiencing a full ROM in both upper and lower extremities. At this time, I'm going to also ask you to, I'm going to be doing the capillary refills on your toes. And the capillary refills are +2 and brisk. I'm going to be doing them on your hands. And I'm also going to be checking the skin trigger on your hands and the capillary refills on your hands. They are brisk and +2. Checking the skin trigger on your feet. That is fine. I'm going to be asking you to move on to the side this way, please. So at this time, I'm going to be asking you to get up, put your hands straight out, put your feet together, close your eyes, and I'm going to be viewing you to make sure that there's no swaying and your balance is fine with the Romberg's test. There's no signs of swaying. At this time, I'm going to have you actually walk back and forth to this table. The patient is ambulating with no assistive devices, and there's no abnormalities in the ambulation. I'm going to have the patient take a seat and sit back again. At this time, I'm going to be assessing the patient's abdominal, and I'm going to start by inspecting, making sure that there's no masses, that there's proper hair distribution, that there's no bruising and no scars. Then I'm going to auscultate from the right lower quadrant, starting from the right lower quadrant and moving my way up, making sure that there is bowel sounds and bowel movements. Doing this for 60 seconds in each quadrant. And the patient is experiencing normal bowel movements. At this time, I'm also going to be percussing. And I'm going to be palpating. Please let me know if you feel any tenderness or discomfort.
No.
Okay. At this time, I'm also going to be listening to your lung sounds. There should be 6 in the front, and I'll be listening to for any adventitious sounds. If you could take a deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. And a deep breath. Perfect. I don't hear any adventitious sounds at this time. So I'm going to have you move forward a little bit. So I'm going to be inspecting your back. I'm making sure that there's there's symmetry in your spine. There's no signs of scoliosis. So at this time, I'm also going to be auscultating the 8 lung sounds in the back, making sure that I avoid any bony prominences to get the most accurate readings. And if you could take a deep breath for me, and a deep breath for me, deep breath, deep breath, deep breath. There is no adventitious sounds in the lungs. Do you ever have any shortness of breath? No?
No.
Okay, so at this time I'm going to ask you to lay back. I'm going to be checking your cardiac sounds. Do you have any heart murmurs or any cardiac arrhythmias that we should be aware of?
No.
Okay, so I'm going to start off with the aortic, and then I'm going to move on to the pulmonic, then to the Erb's point, to the tricuspid, and to the mitral/apical pulse. There seems to be no abnormalities that I could hear. At this time, I believe that everything has been concluded in our physical assessment. I'm going to wash my hands, take off my gloves, wash my hands. Is there any questions that I can ask you?
No.
Or any questions that you have to ask me, like I said?
No.
No? Okay. So the patient's overall physical assessment has been completed. I will be documenting my findings and letting the provider know.
Thank you.